facebook.com/Salam Media.
The time is just gone 20 minutes past 8 a.m. this morning on News and Views, and we're now talking with the South African Federation of Trade Unions, and they've issued a statement, in fact, the Eastern Cape provincial statement on community healthcare workers. And we joined on the line this morning by Mzi Nkata. Mzi, good morning to you and welcome to the show.
Good morning to you, good morning to the listeners, and thank you for having me.
Right, Mzi, let's talk about the plight of community healthcare workers. Now, I see SAFTU fully support the demand of community healthcare workers so that they can be insourced and be permanently employed by the Department of Health at a certain salary scale level. What is the issue right now as far as community healthcare workers go?
Okay. Yes, as SAFTU, we are calling for permanent employment of community healthcare workers, and the statement is coming from Eastern Cape, but we are calling for this nationally in all our provinces, everywhere where community healthcare workers are not permanently employed. We are saying this is enough; they should be permanently employed. This has gone for a very long time. As we all know that since the outbreak of HIV and AIDS, community healthcare workers were there and are still here. Even on this pandemic, they are here. They are the ones who are giving treatments to people with HIV and AIDS, who are tracing back the defaulters, tracing back people who are defaulting on TB treatments. And all these years, since they have started in 1992, they've been doing this job with nothing in their hands. They don't have any permanent salary. They don't have any benefits from the department, as they are doing this job for the Department of Health. So even if a person dies, that person will die with nothing. They will leave their kids with nothing. They don't even have proper houses to live with their families, because if we can look right now, they are only earning 3,500 a month. And also, while they earning this 3,500 rand a month, they are under the PESAL of government, PESAL of Department of Health, which is now making them more vulnerable and exploiting them more, because once you punch on any system, it shows this person as a government employee, meaning they are being blocked from getting any assistance, any help, including if they want to go and apply for their kids for NSFAS, even if they want to go and apply for RDP houses, for grants, they can't get any of those, while they are earning only 3,500 rand a month. So as SAFTU, we are saying this is enough. And the most painful part about this is the fact that we have fought for so many years as labor movement, fighting that all community healthcare workers must be permanently employed. Up until in 2018, we managed to win a resolution which was signed and sealed that this year, June, 1st of June, all community healthcare workers will be permanently employed. But our government did as they always do. They reversed everything. They didn't apply, they didn't comply with the resolution, which is why we are still on the streets fighting and saying we demand community healthcare workers to be permanently employed. So now what National Treasury is saying is there is no budget to pay community healthcare workers, of which we are saying as unions, we do not agree with that. National Treasury must see where they go and source funds to pay community healthcare workers. As they are the backbone of health, you can go anywhere, you will find community healthcare workers being in the forefront of health, doing all the jobs that needs to be done, giving all proper needs that need to be given to the communities. So that is why we are calling for community healthcare workers to be permanently employed.
Now, also, Mzi, just to understand, how big an issue this is, do we have any idea as to how many community healthcare workers we've got nationwide?
Nationwide, I'm not sure about the statistics, but the last time I checked in my own province, we were sitting at more than 5,000.
Okay, so that's just in one province. So we are looking at a good few, quite a sizable number of community workers right across the entire country.
Right across the entire country, yes.
Right. Now, I know that obviously this is not only restricted to community healthcare workers. There are also what we know as ECD workers, early childhood development workers, who are in a similar situation. Okay, so that's just in one.
Yes, that's correct. You can count also the early childhood development. There's also EPW and so on. There's many people that are affected by these actions from our government of just using people and giving them a stipend without employing them permanently and give them different wages. So even in our schools, it is the same situation. We've got teachers who are there, qualified teachers who are giving education from a very early age of a child, but they don't have any decent salaries. They don't have any permanent salaries. They only they depending on the school fees that is being paid by the parents. Of which now, if we can look at this situation, tell me a parent who is a community healthcare worker who is only earning 3,500, who doesn't have money to pay these school fees, of which this same school fees must be a salary of a teacher, an SGB teacher who is at school. So we are in that poverty and that hunger, which is why we are calling for our government to stop killing us as a nation, because this is destroying all of us as a nation. This is destroying the economy of our country. So everyone is just in a situation where we don't know when is our government going to stop treating us in this manner.
Now, Mzi, obviously you've issued the statement now. Where to from here now that you've issued the statement? What are some of the actions that you are contemplating?
What we are planning as SAFTU, we have submitted at NETLEC our Section 77, where we are going on a full-blown strike early next year in February, where we are directing our fight straight to the National Treasury, because we believe that the stumbling block here is the National Treasury, because everything has passed, everything has been granted is there, but National Treasury keeps on saying we must go and apply for an exemption, and there is no money. So we cannot be listening to that when we know fully that there are resources that are being misused, and there's this corruption that is happening and so on. So National Treasury must stop playing with people's feelings and people's emotions, and they must start doing what is correct.
Well, Mzi, we're going to have to obviously leave it at that. Obviously, this is quite a major issue. It's quite a major problem from what you have described. And we hope sanity can prevail, actually. And at the end of the day, the government obviously, sits up, takes notice, but more importantly, and does something about the plight of the community workers or the community healthcare workers that you speak of. But for now, thank you. We appreciate your time with us.
Thank you very much. And we continue saying community healthcare workers are the backbone of the health system. They must be permanently employed. Thank you very much.
Mzi Nkata joining us this morning. And when we come back, we'll be joined by Abubakar Tapelo Ahmed, who has been appointed as a member of the Mayoral Committee, MMC, for Development Planning in the city of Johannesburg.